Good evening, Ananda. I'm Dr. Sanand from Kerala, a land of Ayurveda, and also called as God's own country. I come from an Ayurvedic family where we have an Ayurvedic tradition of around 400 years and fourth generation Ayurvedic doctor from my family. My topic for today's presentation is Ayurvedic substitution for modern Ayurvedic medicine. Lord Dhanvantari is considered to be god of Ayurveda. This is the hospital where I practice. I am the chief medical officer of Sree Subramania Ayurvedic nursing home, where we treat the patients. So, rheumatoid arthritis is very common nowadays, and the global prevalence of rheumatoid arthritis is 0.5 to 1% of adults. And in India, the prevalence is 0.7 to 0.92%, higher than the global average. And it affected in India around 42.2 million people. So, RA is an autoimmune disease, chronic inflammatory disorder, affects the peripheral joints, causes pain, swelling, and redness, and movements will be restricted. It's a progressive joint damage will happen in this, and synovium erodes cartilages and bones, leads to deformity, loss of joint function, and possibly affect other organs also at the end stage. So, status of RA. So, initially there will be mild symptoms only, either one or joints affected, not severe symptoms, pain in small joints with less intensity, stiffness in the morning for initial few steps. They may not have much swelling in the initial stages, and also inflammatory markers may not be positive. So they may not have any damages of the bones in the initial stages, but some indigestion and fever will be there. So in the second stage, the synovial inflammation of joint starts in this stage, and there will be mild damages of the cartilages, swelling will be present, and more severe and longer period of stage 1 symptoms will be there. And the stiffness of the joints will be little bit more in the second stage, and the range of motion will be restricted. So in the third stage, inflammation will be severe pain and joint swelling will be the stiffness will be the reduced range of motion of joints, joint deformities, swan neck deformity, Z deformity, Hubbard nodule, everything will be present, and the inflammatory markers also will be positive at this stage. So there are a lot of patients who was completely bedridden in the stage 4. I've seen so many patients bedridden. They were not able to move, loss of mobility, reduced muscle strength, and also the complete disability with the organs getting affected at this stage. So common steroids used in RA is methotrexate, sulfasalazine, hydrochloric and leflunomide, methamphetamine, and these are the common steroids used in the treatment of rheumatoid arthritis. So this is a case study of a patient who have come to us, Dr. Sree. She herself is an allopathic doctor from south part of India, has been suffering from arthritis since 2014. She had symptoms like excruciating pain with joints, swelling was feverish in the morning, difficulty in getting up and fatigue, stiffness. Whenever she experienced stress, her pain would worsen and she would become bedridden. So she came to us in 2017. She was on paracetamol, methotrexate, and steroids, and including prednisone. Over time, her pain gradually worsened, and she continued taking these medications regularly. Eventually, she became so dependent on medication that she needed it even to go to the toilet for basic daily activities also. So she was monitoring her CPP level, and it was very severe when she got admitted in our hospital. She was admitted for a month-long inpatient treatment at our hospital. She has undergone Panchakarma treatment for 1 month. We are given external treatments like Fiji, Dhara, Vasti, and for the joints, we have given some external level applications to reduce the inflammation and with some diet control. And then we have started tapering the dose of the steroids. We don't start tapering the dose in the initial stage of rheumatoid arthritis because gradual tapering is always good. We will start our line of treatment initially and gradually we will taper the dose slowly. So, Ayurvedic approach of tackling the steroids for rheumatoid arthritis. So, in RA, poor digestion can exacerbate inflammation and lead to toxins built up in the body. Ayurveda emphasizes restoring digestion strength to aid nutrient absorption and support the body during the steroid tackling. The first and foremost thing in rheumatoid arthritis is restoration of the function of acne. This has to be done by Deepan and Pachana, carmination and digestion medicines will be included in that. And see, the acne or digestive fire will be deranged in the rheumatoid arthritis, the acne as well as the ductal acne. The digestive fire as well as the metabolism at the cellular level will be deranged. So tissue metabolism and further nourishment will be hampered. So AMA will be produced in the two levels, one at the gastrointestinal level. AMA or the toxins will be accumulated in two levels, gastrointestinal level as well as the tissue level. Tissue metabolism may not happen properly. So the AMA produced, the toxins produced by the deranged tissue metabolism, which is carried to joints and will and accumulate in the joints. And the swelling and other symptoms and the joint destruction of joint cartilage will happen at this stage. To restore the function of digestive fire, dietary changes will be recommended along with the Panchakarma therapies. So, in the treatment of rheumatoid arthritis, dietary restriction plays a major role. So, it is told in Ayurveda to have half the quantity of the food to be filled in the stomach. Kukshir Bhagavatam Bojehi Sthitiye Vayupure Vayu Sanjanatam Chadutam Avasheshe. Half the quantity of the food should be filled with the stomach. Third part should be filled with water, and the fourth part should be filled left alone for the free movement of the air. So that is the general principle told in Ayurveda, but we have to apply that principle in case of rheumatoid arthritis. And we in Ayurveda don't recommend to reheat the food. It is told Kashayam Thailam Vidanjavanjanadikam Sridashidam Punastaptam Sarvam Vishavat Bhave. So once you reheat the food, there is a chance of becoming that food to poison, like Vishavat Bhave. There is a chance. And generally it is told not to sit or sleep immediately after taking the food. Bhojana Bhukta Padashadam Gatva Mama Parshena Samvishe. After taking food, we are supposed to walk at least for 100 feet, and we have to sleep on the by turning to the left hand side. And Ayurveda has given a lot of importance to include all the 6 tastes in the food: sweet, sour, salt, bitter, astringent, and so that also has to be recommended for rheumatoid arthritis patients. And we generally prescribe in Kerala, we prescribe light food like rice, sugar, but place to place it can be changed. Anything light food can be recommended. So generally, we in our part of in Kerala, we recommend to have buttermilk. Buttermilk is an excellent medicine like food to improve the digestion. So generally, it's told Bhojanante Tiket Takram. After having the food, you are supposed to have buttermilk. Vasarante Tiket Payaha. Night time, you have to have milk. Dinante Tiket Vayu. Early morning, you have to drink water. If you do like this, means you don't get disease if you follow this from the childhood days. So same thing is told in Bhagavad Gita also. Ayush Sapta Valarogya Sugapriti Vivardhana Rasya Snigdha Sthira Hridya Ahara Sattviga Priya. So Sattviga Ahara is always recommended for human beings. And Kattuamba Ramakrishna Tikshna Ruksha Vidharina Ahara Rajasasya Bukha Shoga Ametrada Kadu Amla Panchan taste, spicy food and all, it's Rajasika Aharas. It will create Dukkha, Shoga and Amaya. Sadness, you get worried, and it also imbibe the diseases. And also told, I mean, Bhagavad, this is not Ayurveda, it's Bhagavatam, Bhagavad Gita. Yadayama Gadarasa Bodhita Jishitan Jaya Uchitaja Ametyam. Bhojanam Tamasa Priya. So if you take reheated food that left for one day, and it's a tamasika ahara and it's not good for health. And so see, Ayurveda is a science that it's a complete science. It's not like a painkiller given in allopathic or any modern medicine. We have the medicines and the treatment to rebuild the tissues also. So as steroids have happened, it is essential to rebuild the joint health and repair tissue damage caused by rheumatoid arthritis and prolonged medication use. Ayurveda uses specific herbs and nourishing therapies for this purpose. Another that mainly we use is ashwagandha, and there are a lot of medicated ghee preparations mentioned in Ayurveda to rebuild the cartilages and the bones that got degenerated for long-standing rheumatoid arthritis. So tapering steroids for RA can be challenging, but Ayurveda provides a holistic, natural solution by focusing on improving digestion, detoxifying the body, and strengthening joints. This approach not only supports the tapering process but also addresses the root cause of disease. So Ayurveda is a complete science. Swastasya swasthya rakshanam madhurasya vikara prashna. It's not only treat the disease, the science that helps to maintain the health of health individual. It's a complete science. Thank you. Thank you for the question.